Hey friends, if you're dealing with sciatica pain, I have a great video for you today. I'm going to walk you through the best exercise to get rid of your sciatica pain fast. Here we go. Welcome back friends, Dr. Josa here to help you move better and feel better. Thanks for tuning to the show today. And if you're new to the channel or haven't already, make sure you hit that subscribe button so you don't miss out on future videos. Sciatica is a common condition seen in the clinic, impacting 10 to 40% of people during their lifetime. The sciatic nerve, which runs down the back of the leg, originates from L4 to S3. Coursing down the back of the leg, it provides direct motor innervation and sensation to the lower leg. Sciatica pain can start in the low back, move through the hips, into the buttock, and down the back of both legs. Pain can travel down both legs, but more commonly it travels down one leg. It can be caused by compression or irritation anywhere along this pathway. Sciatica type pain can also be caused by a condition called Piriformis syndrome. This muscle, the piriformis muscle, can tighten, spasm, and cause irritation and compression on the sciatic nerve traveling down the leg. The exercises I'm going to show you today, guys, are going to help decrease the irritation and pain caused from the sciatic nerve, also improve its mobility, and strengthen and stabilize the area. The first exercise we're going to perform today, guys, is a nerve glide for that sciatic nerve to get that moving better, decrease any irritation along that pathway as it travels down the leg. There's two ways we're going to perform this. The first one is going to be on our back, and then the next one we're going to perform is in the seated position to give you two different options. So to perform that sciatic nerve glide on your back, you're going to bring one leg up to 90 degrees at the hip, support your leg behind the knee with your hands, and then with that leg, you're going to kick up towards the ceiling, keeping your ankle relaxed until you get into tightness. And then you're going to pull your foot back slowly and then relax the foot. Bring the leg back down, and that's one repetition. Slowly kick that foot up towards the ceiling, pulling that ankle back, foot back, relax, and down. Work into that tightness at the top until it gets tight. Pull back, relax, and down. This will get that nerve moving better down the back of the leg, decrease irritation, and improve mobility of that nerve. If you're finding difficulty with that nerve glide on your back, we can perform a modified version in the seated position. So for that nerve glide in the seated position, we're going to scoot forward towards the edge of the chair. You're going to stick that leg out straight that you're going to perform that nerve glide on. With the leg straight, what you're going to do with your foot and ankle is you're going to pull that foot up towards the ceiling, pulling it back until you feel tension in the leg, and then you're going to relax. So you're pulling back on the foot, feeling that tension tighten up, and then relax. Improving the movement and mobility in that nerve running down the back of the leg. Same thing, perform 15 to 20 reps, 2 sets. The next few exercises are going to work on stretching those muscles around the hip, including that piriformis muscle, decrease irritation on that nerve. The first stretch we're going to perform is to bring our leg up, and you're going to pull across your body towards your opposite shoulder. So right leg, we're going to pull up and towards our left shoulder until we feel a stretch on the back of the right hip. Hold that 30 seconds and then relax. So pulling that right knee up towards our opposite shoulder, towards that left shoulder, pulling up and across, feeling that stretch on the back of the right hip. Hold that 30 seconds, mild to moderate stretch. The next stretch we're going to perform is to bring your right heel up and over your left leg. Hold that position. You're going to grab your left leg and pull your left leg up towards your chest. Pulling that left leg up towards your chest, feeling that stretch on the back of the right leg, holding that 30 seconds, and then relax. So bringing that right heel up and over onto your left leg, holding that position, grasping your left leg, bringing that left leg up towards your chest until you feel that stretch in the right hip. Hold that 30 seconds, 3 times. We can also perform the stretch in a seated position. In the seated position, we're going to bring our right heel up and over onto our left leg. Grab that right knee and you're going to pull that up and across towards that left shoulder. Pulling that right knee up and across until you feel that stretch in the hip. Hold that 30 seconds. Relax, and you'll perform that 3 times. The next 3 exercises are for muscle activation to strengthen and stabilize the hips and core to decrease your sciatica pain. With the first exercise, we're going to perform posterior pelvic tilts. Lying on your back with your knees bent up, hands at your side. You're going to take your pelvis, tilt back into the table or floor, hold 5 seconds, and then relax. You should feel like your back flattens out just slightly as you push back into the table or floor. Not a lot of movement. You should feel that rotation, pushing back, hold 5 seconds, and then relax. Perform 15 reps, 5-second hold, 2 sets, up to 2 times daily. Pushing back into the table or floor, open up that low back, decrease irritation on that nerve, and strengthen and stabilize around your pelvis and core. All right, guys, we're going to perform 2 exercises for the hip to strengthen and stabilize that area to further decrease your sciatic pain. Lying on your side, we're going to perform clamshells first with your legs bent up, keeping our feet together, hip forward. You're going to lift that knee up towards the ceiling, hold 5 seconds, and then control back down. Hip forward, lift that top knee up towards the ceiling, hold 5 seconds, and then relax. Slow and controlled up, hold, come down. Feel that burn and fatigue on the back side of the hip. Perform 15 reps, up to 2 sets, and up to 2 times daily. If you have a resistance band at home, you can also add that for the clamshell to further strengthen and stabilize the outside of the hip. So in that sideline position, with that band above your knees, you're going to lift that top knee up towards the ceiling, hold 5 seconds, and then come down. Slow and controlled fashion, hold 5 seconds at the top, come back down. Further strengthen and stabilize that outside of the hip and decrease your pain. All right, guys, our last hip strengthening exercise is to perform sideline hip abduction. Lying on your side, you're going to have your bottom leg bent. Top leg is going to be straight. Keeping your hip forward, you're going to lift that top leg up towards the ceiling, keeping our knee straight. So hip forward, knee straight, lift up towards the ceiling, about 45 degrees, and then come back down. So slow and controlled fashion, lift that leg up towards the ceiling and down. Keeping that hip forward, lift up towards the ceiling and down. Just feel muscle burn and fatigue on the outside of the hip. Strengthen and stabilize. Decrease pain in that nerve. Perform 10 to 15 reps, 2 sets, up to 2 times daily. Thanks for watching today, guys. Perform these exercises to get rid of your sciatica pain fast. If you found today's video helpful, click that like button and the subscribe button so you don't miss out on future videos. I'm Dr. Josa, helping you to move better and feel better.